Hello, everyone. This is my report to the Coalition on Cardiovascular Disease, and I am Jessica Hubbard. Determinants of health. Cardiovascular disease is a global health disparity and is the leading cause of mortality worldwide. The basis of this report to the Coalition is to raise awareness, provide data that substantiates this concern, and propose a theory-based initiative to implement interventions that may decrease cardiovascular disease. Determinants of health are multifactorial and are known to start early in life. Things like family habits, which include eating, drinking, smoking, and physical activity, are some determinants of cardiovascular health. Access to healthcare, insurance, and transportation to and from their healthcare provider play pivotal roles in cardiovascular outcomes. Kretstolis' article provides strategic ways of counteracting the risk of developing CVD, otherwise known as cardiovascular disease. Having a low socioeconomic status tops the list by essentially stating poor, indigent populations are at a risk for CVD. This ties into health literacy, transportation to and from their doctor's appointments, for primary care visits, and being able to afford their medication. A sedentary, not physical, active lifestyle and tobacco use contribute significantly to CVD, as well as a plethora of other comorbidities. Because smoking is viewed as an addiction, we must first understand and be sensitive to the cultural and physiological factors relating to this behavior. Developing a unique intervention to promote smoking cessation is essential to abstinence from tobacco. Technological interventions and theories. There are various theories that can be applied to how and why people do the things they do. Technological advancements have created many tools and applications that can help individuals live a healthier life and may offer a window into their lifestyle choices. This may be accomplished by decreasing their tobacco use and increasing their physical activity while incorporating different theoretical frameworks to build their interventions on. Developers and proponents of healthy lifestyle applications have created successful tools for the public to utilize in their quest of decreasing these cardiovascular risks. One example is the Fitbit, which communicates with an individual's smartphone and is used to track steps, activity levels, heart rate, and sleep patterns. One way the Fitbit promotes health is by setting daily goals. The average goal is 10,000 steps per day, but that number can be adjusted based on user preference, and it praises the individual on goals met while offering encouragement. One component that is especially appealing about the Fitbit is its mechanism of action is relatively private. One study found that physical activity was increased after 6 weeks of using a Fitbit-type tracking device in those that suffered from being overweight or obese. The social cognitive theory can impact the success rate of these fitness tracking tool applications. A component of the SCT is the level of readiness associated with specific goals. Typically, a person who purchases a Fitbit is aware on some level that they need to increase their physical activity. This is promising evidence showing their cognizance in relation to why they are utilizing a Fitbit. One demographic that may not be as technologically as savvy as others could be the elderly population. The font on a Fitbit watch is small and cost could be another factor. This device is one that the user has complete control over, and their private information is stored on their smartphone or similar equipment. Ethically, the use of a Fitbit, coupled with its discretion of personal information and goal statistics, seems like a promising technological advancement for decreasing cardiovascular risk associated with sedentary lifestyles. It is important to have a well-thought-out proposal with a structured theoretical framework to provide support for the program. The next slide is a table that depicts the performance and change objectives in relation to decreasing tobacco use using the social cognitive theory. It is broken down into categories relevant to the SCT. Self-efficacy plays a key role in decreasing cigarette consumption. How many attempts at cessation were successful, and the length of abstinence associated with it. It requires an individual to be transparent not only with the surveyor, but also themselves. For the first performance objective, it asks smokers to identify smoking as an unhealthy behavior. by assuming each individual is cognizant of the health risks associated with smoking would be negligent. Therefore, asking the smoker if they are aware of the risk is key. In order to measure this, there would need to be a questionnaire asking if a person is aware of the risk of cardiovascular disease associated with smoking. Next would be listing the consequences of smoking, acknowledging what stage of self-efficacy the individual is categorized under is essential to the success of the program. Another socio-structural factor that can impact the success of the performance objective is health literacy. An article by Stewart focuses on the importance of health literacy and how the impacts of low health literacy can create an environment that is conducive to poor decision-making skills regarding one's own health. Individuals with high health literacy are able to make a more informed decision on behavioral risk factors associated with smoking. One particular study used the HSI, the Heaviness of Smoking Index. This questionnaire asks two simple questions. The first asks, on average, how many cigarettes are smoked per day, and the second is asked the participants to state how long after they have awoken for the day do they smoke their first cigarette. This tool has been shown to be an appropriate indicator of tobacco addiction and subsequent relapse into smoking. Evaluation plan and conclusion. Utilizing intervention mapping techniques that are outlined by Koch can impact the structure and success of the program. It is crucial to differentiate the various determinants of health and view different taxonomies that may benefit the particular individual. This intervention would be measured over a 6-month period with participants that are currently smokers. It would require self-reporting of the number of cigarettes smoked per week to indicate if they have shown a decrease in usage. Another questionnaire incorporating a Likert-type scale of measurement would be scored on how confident they are and empowered they feel since the implementation of this program. Addressing any difficulties or triggers the subject may encounter can help future programs of the same structure and purpose. The goal of this project is to develop a well-planned strategy that delves deep into the behavioral and social determinants of health while using theoretical frameworks to assist those at risk for developing cardiovascular disease. Thank you.